Hi, this is Dr. Clayton Moliver. Welcome to my vlog. So when you come in to see me for a breast augmentation consult, of course I'm going to talk to you first and interview you. I want to know about your breast history and your family breast history to make sure you don't have any history of breast cancer or breast disease, or if you've had any previous surgeries. A lot of my patients come in and they've had other breast surgery and they're here for complications. But for a straightforward breast augmentation, I'm going to want to know your history, your medical history, and that kind of thing. Then we'll get to your exam. When I examine you, I'm going to take some measurements. I'm going to take a measurement from your sternum to the nipple, from the nipple to the inframammary fold. We're looking for certain proportions. I'm going to assess you for the shape and the architecture of your breast. Some breasts are just very nicely shaped and they're a great candidate for breast augmentation. We want to see a nipple that's equal to or above the inframammary fold. If it's below the inframammary fold, we call that ptosis, P-T-O-S-I-S. The P is silent. But droopy breasts add another dimension to a breast augmentation, and I'll talk about that in another vlog about mastopexy with breast augmentation. Then we're going to assess whether you're a better candidate for saline versus silicone. Most times silicone's a better choice, but in some women saline works just fine. Then we'll talk about what kind of incision. I'll talk to you about the risks and complications of breast augmentation. They're rare, but they do happen. You have about a 1% chance of having a postoperative bleed. If that happens, it's a return trip to the operating room. We put you to sleep, we open it up, we take out the implant, we wash it out, we cauterize whatever's oozing, put the implant back in, sew you up. You usually wake up more comfortable than when you went to sleep. You can get an infection. To my knowledge, I've had 6 in 20 years, or about 0.1%. So they're really, really rare. You really want to think about taking implants out when you have an infection. And I see patients come in from Mexico and from out of state that suddenly show up with a breast infection. You got to get those implants out. That's the rule of thumb. And then usually you can get them back in at about 3 months. You can lose nipple sensation. This is very unfortunate, but it only happens at about 1 or 2%. People ask me, well, why does it happen? And my answer is, well, I put you and your twin sister, you didn't know you had a twin sister, did you? I put you at a keyboard and say, okay, start typing 8 hours a day for 20 years. One sister gets carpal tunnel surgery or carpal tunnel syndrome in 6 months. The other one types for 20 years. Everyone's nerves are a little bit different. And in a breast augmentation, the nerve gets stretched. The nerve comes over the muscle. So it's a good reason to put the implants under the muscle. Also, I think it protects the nerve to a large extent. But the nerve can get stretched and you can lose sensation. Most of the time, you'll have altered sensation. Actually, it can be hypersensitive for a few months, but usually calms down. Most patients will recover or regain normal nipple sensation within a few weeks to a few months. I've had some patients regain normal nipple sensation after a year. I've had some lose it, and like I said, that's very unfortunate. Those are all tiny percentages. The one thing that does happen, 5 or 6 or 7%, is revisions. Nobody's perfect, I'm not perfect, and I haven't met a patient yet that's absolutely perfect. In fact, I'm sort of scared of the word perfect. But at any rate, revisions do happen. So what happens here? Well, maybe somebody bleeds 4 or 5 tablespoons or 3 or 4 tablespoons around their implant. A couple of little blood vessels ooze a little bit. And it sets up some scar tissue and the breast gets a little bit hard. We're going to follow you for at least 3 months, sometimes 6 months after surgery. Usually by 8 to 10 weeks, I'm going to say to you, this bright breast has dropped in too much, or maybe it's a little bit hard, and we're going to have to do a touch-up surgery. We charge you a facility fee for a touch-up surgery. It's several hundred, not several thousand. You don't get charged a surgeon's fee again. But it's usually about a 20-minute to 40-minute operation to clean up some scar tissue in there, and it usually fixes the problem, and that's that. How long do implants last? Women have this idea that implants last 10 years. Not true. In fact, the implant company warranties them for life. The implants last forever. Unfortunately, you and I don't. And will age, and that's the problem. It's the surgery that lasts 12, 15, sometimes 20 years, sometimes longer. A very petite, very small lady who gets a breast augmentation with a very small breast, she may go 20, 30, 40 years. It's the woman that has a B cup or a C cup that gets a breast augmentation who might have enough breast tissue to camouflage the implant and have a fantastic result. Unfortunately, 12, 13, 15 years later, maybe a baby or two, and that breast tissue that's in front of that implant becomes softer and ptotic and droops. And so she comes in and says, Dr. Moliver, in a bra, I look fine. Out of a bra, not so much. That implant forms a pocket. And that pocket's nice and soft and mobile and everything's fine, but it doesn't drop and age with the breast. And so it's the operation that has a lifespan, not the implant. If you go to my website and look on my blog, I've written a nice blog about this in more detail, and you can read about it there. And we're talking about breast augmentations and complications of breast augmentations. So even though I told you about all the things that can happen and they're kind of scary, we've done studies, our society has done studies, and the vast majority, 98% plus, love their breast augmentation, would do it again in a heartbeat. And as one of my estheticians, or actually one of my nurse anesthetists used to say years ago, and she was very athletic, and she'd always say, after my patients went to sleep, why are these ladies doing this? After I did her breast augmentation, she said, you know, Dr. Moliver, it just makes me feel more feminine. And that's about all I can say. And that's been the experience of our Plastic Surgery Society when we've interviewed women. It's a very, very happy operation, and 95, 98% plus are thrilled with having a breast augmentation. Thanks for visiting my vlog. This has been Dr. Clayton Moliver. If you want to explore plastic surgery, please give us a call at 281-282-9555. You can Skype video conference with me at Doc Moliver, or you can reach us on the web at drmoliver.com.